There will always be controversy on any screening test. In particular, there was a recent Canadian study that came out that said they didn't find any real difference in survival in women who had mammograms than those women who didn't. And there were some major flaws in that study. One thing I think is important for people to know is this study was published from data from the early 80s. In the early 80s, we were doing mammography, certainly not nearly as well as we're doing it now. We were doing what we call analog mammograms, where they would take mammograms, actually process the film in a dark room, allow it to dry, and then read it after a radiologist would be able to interpret those images. We are far away from that technology now. Not only have we moved to digital, but we've moved to 3D. And so we're able to find many more cancers based on the better technology that we have. One of the other flaws is that the technology that they had with the mammograms that they used in the early 80s, they were only able to detect 30% of cancers using those mammograms. Nowadays, about 60% of our cancers are detected on the mammogram. So certainly the technology is better. We have better experts now who are dedicated at reading breast images, and all those factors really play a big difference. There are no experts out there that can disagree that women who have mammograms certainly lessen their chance of dying from the disease. And if anyone has any questions, they can certainly ask any of the hundreds and hundreds of women that are diagnosed within our own network. By purely finding their cancer on the mammogram was the reason that we were able to find it and treat it early, and I know that we're saving those women's lives by doing that.